All right, there we go. Hey, everybody, it's Katie Harris, owner and CEO of Nursepreneurs, and I'm here with Dr. Arvin. I'm not going to attempt your last name, but Dr. Arvin from Zen Labs. So very, very excited to have you here with us to talk about peptides, and specifically, we're talking about cognitive peptides. So, if you guys have questions, make sure you put them in the comment sections. But Dr. Arvin, I'd like to hand it over to you.
Yeah, so we're going to talk a little bit more neurocentric, I think, than anything else here today. So feel free, like Katie had mentioned, stop me anytime if you have some questions. Love to, talk a little bit more about the questions. But one of the things that we're trying to do is really start putting together protocols and programs that make the most amount of sense. It's easy to sell someone a peptide saying, "Hey, take this," or sell someone a regenerative product and say, "Hey, take this." It starts to make a lot more sense when you start putting them together in a bundled package. And let me show you something, if that's okay.
I'll put. Can you see how to present? There's a present button down at the bottom. Okay.
I see it, and I'm going to show this real quick. And this is a pretty cool program that we started putting together. It's a very simple one, and I just wanted to quickly talk about this on how you can help with your brain and mental health. So, we have 3 parts of this program. We have the phase 1 and the phase 2, and then the regenerative support, which is at the bottom. So when it comes to neuro, there's a few things that I love peptide wise. There's a few on here that are great. So Cmax, salank, and Dhexa, they very well bundle together. Cmax does more on the helps with more on the neurotransmitter releases, helps with the circulation of blood flow within the brain. Salank is more on the neuropsych, helps definitely with some of the serotonin and dopamine modulations. And their Dhexa is a really nice one. Those who you've not tried it, it's actually one of my favorite ones for several reasons. It definitely helps with the HPA axis activity, helps improve your sleep architecture, and it empirically decreases your cortisol levels within your system. So it's great from an overall mood, cognition, neuro improvement setup. We like to do this as an 8 to 12 week course. I don't like to do too many peptides more than 12 weeks. So let's use this as hey, before you go to bed, we'll combine these 3 peptides. We can get you 1 vial with 3 peptides for a 12-week duration. And then from there, we want to switch you. Now that you've kind of got yourself accustomed, we don't want to create a receptor attenuation. Let's get you on to something that's going to also promote a better overall mental environment and brain environment. And the 2 that we're looking at here, these are more geared towards the mitochondria. And I think as we start to push forward more into the next, I guess, second half of this decade, I think mitochondrial health is going to go basically hand in hand with longevity. And when you look at mitochondrial health, it's more than just brain health. It's heart health. It's kidney health. It's anything and everything health, right? And one of the top ones that I'm very bullish upon, and many longevity experts is SS31. So SS31 is a mitochondrial enhancer. It works on the mitochondria, and it works very specifically as an organ protective agent. So when I say this, there's actual good studies out there where you see people with kidney issues, brain issues. It will actually improve on those conditions that they have. Obviously, brain sometimes is not as numerically based, but you can see creatinine levels in the kidneys, for example, improving with SS31. So you can kind of equate that to the brain. So yes, it is very neuroprotective in many, many ways. Personally, I like doing very high doses of SS31, and I kid you not, I'll actually do about 2 milligrams a day just to really get myself going. It's kind of cost prohibitive for most people. So we don't necessarily say you need to go that high of a dose. So we have it listed here as a little bit of a lower dose. The NAD plus obviously is a cofactor. It is not a peptide, but a cofactor that very well plays into the fuel source of the mitochondria. It helps replete your NADPH, and that's where you're going to end up with getting gasoline into the engine per se. So when you have SS31 and NAD plus combined, you're going to have the more synergistic opportunities to better improve those synapses, better improve those modulations, your neurotransmitters, to be in accordance with each other. So it's a great phase 2. I really like these pairings together. And then anytime we talk about neuro, one of the big things I've been pushing forward on, and I'll talk a little bit more in detail, is about the cell regenerative factor, or the cell factor that we have now. And this is your regenerative molecule that is extremely great for a multitude of different types of scenarios. When it comes to holistic brain support, or even with certain disease processes, it does a great job of decreasing the inflammatory aspect, decreasing the brain inflammation, and regaining and restoring some of the function that you may have had earlier as well. So with the cell factor, you can do it in a few ways. When it comes to brain, doing it as an intranasal, we have an adapter. It's a one-time straight into the nose, into the brain. It works pretty darn well. And people tend to have pretty immediate responses, meaning you'll feel it within 10 minutes of hitting your system. You'll feel a sense of euphoria, a sense of a glow throughout your system. And then you have a very systemic response to this over the next 30, 60, 90 days. And I'll get through the science in just a minute. But this, you could do a 1 or 2 per month as a subcutaneous or intranasal. We offer half vials. We offer full vials. Once again, it's based off the price. Full vials is what I always push forward on. But this is just a sample of one package that we have, and it's very consistent and specific towards brain and mental health.
So the intranasal, can you nebulize it as well, or is it like just a spray thing?
So you absolutely can nebulize it. The issue when you actually start nebulizing is instead of going through the blood-brain barrier through the nose into the brain, nebulization a lot of times creates where it actually will go into your lungs. You can actually do a really good job with COPD, asthma with this product. But I mean, if you're looking more from a neurological perspective, yeah, it might be better to just do an actual intranasal. But end of the day, when this gets into your system, it's going to go find locations that are needing to be helped with both inflammation as well as recovery. So if it's more located in the brain, it will still cross over to the blood-brain barrier. It's very small molecules, right? And these are all signaling molecules. It's going to actually allow your cell to reprogram itself.
Okay. And can you do it IV as well?
You can do it IV as well. Yeah, okay. IV works great. The reason I don't mention IV a lot is because, once again, it's for accessibility. Not everyone has the ability to do the IVs, but anyone can do a sub-Q. Most people can do intranasal, but absolutely IV works phenomenal.
Awesome.
Anything on that specifically, Katie? Anything from the group out there? And I can talk a little bit more specifically on the cell factor and the nuances about that.
Yeah, I definitely want to hear about that. So, but the Semax, Salank, and DSIP. So I know you guys have those all separately, and I think you have Salank, DSIP. Do you take them all at the same time, or is that 2 different injections?
So we have it now, and it should arrive, I think, very soon into the warehouse. Those 3 will be combined into one package.
Okay.
Yep. And I've been honestly mixing them together in the same vial for a while now. I think it just works too good together not to have it together.
Yeah, because it's a pain in the ass to have to do like 3 different injections with all these peptides.
I am 100% with you. Your skin starts feeling like it's just all covered with like poke marks, and it's awful. I agree.
Right, and from a compliance standpoint, it's just getting people to do it is so it's so much easier. I love that you guys have these combinations.
Yeah. So I honestly say, hey, listen. As much as we can do and put together these blends, and we're going to start doing more. We're going to do it, and this is a great blend. These 3 work really good together.
Okay, yeah. So yeah, I definitely want to hear more about cell factor.
Yeah. So the easiest way to explain cell factor and why this is a much more derived and better product than what we're accustomed to in the market, and what we're accustomed to in the market. Let's put that out there: stem cells and exosomes. Right. That's what we hear about. So what are stem cells? What are exosomes? What are cell factors? Well, stem cells, your OG in a sense, in terms of what has been done for the last 15 years or so. Stem cells basically signal exosomes, which are basically vehicles of operation. So I always equate them out to be balloons, and I'll get to that in a second. But stem cells signal the exosomes to drop off the end product, which are messenger RNA, microRNA, protein, etc., at the cellular site. Right. That's how this whole regenerative medicine aspect works. So the thought process was, hey, why do we need stem cells? Let's go directly to the exosomes. So now you have a lot of these companies in the last 5 years, 7 years, pushing forward on exosomes. The issue with exosomes that I have is, I'll use an example where you have a company saying that, hey, we have 2 billion exosomes in this vial. So I look at it, we have 2 billion balloons in this vial. Okay, so what does this 2 billion balloons mean? To me, it's kind of convoluted, right? Because the only real value is when that balloon pops and what's inside that balloon gets delivered to the cellular site. So when you have 2 billion balloons, we have to go under the assumption that every one of those 2 billion balloons has something inside of it. That's not necessarily the case. There may be a lot of balloons that are empty in nature. There may be some balloons that have just garbage, just things that don't really function and may not be actually necessarily good for you. Granted, we're hoping that most of those balloons in an exosome product are good and are going to create viable solutions to your body. But once again, the timeline there gets confusing. When is that balloon going to pop? Is it going to pop today? Is it going to pop 3 months from now, 6 months from now? When is that all going to happen? I couldn't tell you that. There is, unfortunately, no real scientific timeline in a lot of these. It could be a very much a case-by-case scenario. So with cell factor, what's been done through a proprietary technology is the placenta actually has been placed into an incubator. It's been very much cleansed of any source of, they screen it, not cleansed, sorry. They screen it for any sorts of disease processes, even COVID vaccinations, you name it, it's been screened for that. In this incubator, there is an excretion process. When this excretion process occurs, the excretion is collected. Now it's an acellular process at this time. There is no genetic composition to this. So when you collect it as an acellular process, you're able to immediately lyophilize it. So it's in a powdered form, unlike your stem cells and exosomes, which come on dry ice, which still has a source of genetic composition or DNA material to it. So that brings me to point 2 real quick. So from a classification of the FDA, most of these stem cells go under the 361 live tissue. This ends up being a different classification, 351A, which leaves us a little bit more in the gray, or lighter shade of gray, I should state, which doesn't create as much of a backlash from the ways you use it, especially when you start doing IVs, et cetera. Anyway, so now we have a lyophilized form of just 100% bioactive material. So what do I know about this? Well, I can tell you in a vial that either it's a half vial with 2 micrograms or a full vial with 4 micrograms worth of bioactive, 100% bioactive product. I can tell you now from each injection, whether it's intraarticular, intrathecal, IV, subcutaneous, I can tell you the timeline and how this is going to work systemically. I know 30, 60, 90, 120, 360 days from now, what's going to occur, because it's been very much studied and it's going to be time in and time in the same process, because it's not in a balloon. There's no balloons. This is the product without the balloon, if that makes sense.
Yeah, definitely. And, one of the things, because I was always confused by the exosomes and stuff. And what I didn't realize is that, your senescent cells can release exosomes, and spike protein can release exosomes. So you might have 2 billion exosomes, but what are they actually?
Yeah.
So this is much better.
And then, yeah, exactly. So you're always getting everything in your body is always signaling and talking to each other, right? There's always some release of something within your system, something within your body. Your cells are always communicating, talking. There's always a sense of self repair going on as well. Maybe not to the standard as you would get with a regenerative product, but there's always something going on within your body. The other cool aspect of this actually targets 300 different specific cell lines. So you're not stuck to like 30, 60, whatever cell lines. You're looking at more 300 cell lines, which can actually, hit and also try to self-improve.
Yeah. Yeah. So, and when you explain it, it makes a lot of sense. But then when you go to explain it to a patient, or the difference between like stem cells and cell factor, how do you position that so that they understand? Because a lot of time, the stem cells, if you will, they kind of have their own brand where people are asking for them, and they're not necessarily asking for cell factor, even though the cell factor might be better for them.
Yeah, so we tell them this is a placentally derived stem cell product. So the term stem cell is still in there.
Okay.
Granted, it's a much more derived version of it. And we just let them know this is the 3rd generation of technology. So if stem cell is generation 1, exosomes is generation 2, this is generation 3. And we're continuously improving upon the technology. So generation 3 is consistently improving upon itself.
Oh, I like that a lot.
Yeah.
Okay, cool. That's the first time I've heard that said so well.
Yeah. So, and that is the actual truth. I mean, what we have today, in our product is not what we're going to have tomorrow in our product. It's constantly changing. We're making different renditions and small little subtle changes within the product. So it's going to be much more active, much more consistent in terms of its approach, and much more targeted in terms of its approach.
Yeah, I love it. All right, cool.
So I'll talk about a few other really good neuropeptides as well. Obviously, these are a few, but when it comes to neuro, there's a few things, I always try to hit upon. And first and foremost, if you go through what I like to do, my 5 pillars of success, one of the big things when it comes to brain is you got to be very consistent with everything you do, right? So trash in is trash out. So if you don't take care of your body, forget all the peptides and blah, blah, blah that you're taking. It's just not going to happen. So absolutely, when you're looking at good mental and brain health, we got to focus on making sure you do get good sleep, your exercise, your nutrition, your hydration is all balanced and where it needs to be. Number 2, and then Katie, you can speak about this, but there's so much more information coming out about how your gut actually interacts with your brain on so many different levels. And, if you're eating, just junk food and very pro-inflammatory foods, you're going to lead to a dyssymbiosis within your gut, which is then going to cause an inflammatory process systemically, leading to brain fog. And you're going to have also an inflamed brain. Inflamed gut leads to inflamed brain. I mean, that's a simple way of putting it. So those 2 things are huge. Hormonal optimization is humongous for me as well. A brain that doesn't have testosterone, a brain that doesn't have estradiol, a brain that doesn't have thyroid hormones in it is a brain that doesn't exist. So you can't expect to have people that are going to be happy and looking to push forth energy and focus on to different projects of their life if their testosterone's in the gutter, they don't have proper optimization of thyroid hormones. None of that's going to happen. And we focus a lot on testosterone for obviously very important reasons for both men and women, but there's more and more studies coming out for estradiol, especially being important for men. And I talk about this with hormonal optimization so many times. I hate aromatase inhibitors as a whole. So many men take them because they're like, oh, I want to block any estrogen from my system. Estrogen's good for you, for men. Estrogen's really good for men. It creates a lot of balance, especially a lot of cognitive balance in men. And I'm a huge non-believer of any aromatase inhibitors. I really try to get people off of them as well.
Yeah.
So,
because I was going to say, like, when I first trained in hormone therapy, they taught us to do aromatase inhibitors. And it's kind of like, I really come from the framework of the body knows what to do. And if the body is making estrogen in men, even in just small amounts, like why would you block that? And it kind of led me down a pathway of asking those types of questions, and come to find out that it probably isn't a good thing to block it. Maybe there's some instances, but just kind of like routinely to block estrogen after testosterone it seems crazy to me. It's just not something I would do in my practice.
Oh, 100%. And I think what ends up happening is people forget it's not the actual levels that really matter. It's the deltas. And anytime you have these like wild swings, you're going to feel miserable, right? So when people have now realized that, when you start taking, testosterone, whether in men or in women, even though you're saying that, cypionate has a 6 to 7 day half-life, and ethanate has a 4 to 5 day half-life, whatever it may be, taking them in microdoses on an every other day basis almost is going to create this systemic process where you're not going to have your ups and downs. So your testosterone levels are more stable, estradiol levels are more stable, your progesterone levels are a lot more stable. You're not going to have those swings. You're not going to need the aromatase inhibitors almost ever. And that's I think a big thing that we need to kind of focus on as well, I think, going forward.
Yeah, no, that sounds ideal. I like what you're saying is, I totally agree with everything.
But and then step 4, we're talking about peptides, right? So obviously I mentioned, these 5 being phenomenal ones. Really speaking on, the GLP world, Retta to me is not actually none of the GLPs truly are weight loss modalities. And I'll use Retta because I just like retatrutide more than the others for the obvious glucagon receptor aspect to it. But Retta can be used as a true longevity peptide. And that's the way I classify it. I don't classify it as hey, this is a weight loss peptide. Yeah, it can support weight loss. A lot of other things support weight loss too, but it doesn't make it a weight loss peptide. So there's enough information out there by just the way glucose partitioning occurs, why it helps with insulin resistance. It can actually help with the reduction of a lot of plaque buildup within the brain. It can prevent long-term issues with Alzheimer's and other types of vascular dementias. So it's a great aspect to add to your arsenal is retatrutide. Cagrilintide is another really interesting one that's recently come on the market. Cagrilintide is a amylin receptor analog. So it's not an agonist, it's an analog, slight difference. Don't need to get into the specifics of it. But why this is cool, Katie, and I think has a lot of value when it comes to brain health, is you start reading about all these amylin plaques, et cetera, that you're starting to hear more about when it comes to some of the dementias, right? So when you're looking at this is kind of a way to also prevent the plaque buildup within the brain. So you're looking at better, healthier brains going forward. A lot of these, classifications, I hate them because we're looking at it from such a small lens. Yes, satiety is great that you can get that from the cagrilintide, but the long-term effects from both cardiovascular, neurovascular, overall systemic health is just, I think, outweighs it. So Reta and cagrilintide, if you can kind of pair them year on throughout the year, that's what I've started to do, where I'm taking it for 12 weeks Reta, then I'll switch over to 12 weeks of CAG back and forth. So I'm on something consistently that works on two separate pathways, meaning I'm not going to desensitize one of my pathways because I'm overdoing it. I have one pathway for 12 weeks. Now let's switch to the other pathway for 12 weeks. Let's go back. And I keep having that consistent overall health that's still going on a regular basis.
So do you do that once you've gained or gotten to your ideal weight, and then you start doing that? Is it almost kind of like a microdose, even if it's not microdosing?
So I substantially microdose on a lot of these. And once again, from an inflammatory aspect, if you're not looking to lose weight, you don't need to put it into these higher dosing. At higher doses, you will lose weight, and that's the goal of these medications or peptides. But at lower doses, you're looking at it from a pure inflammatory reduction, right? So yeah, so the microdose for weight loss is considered 500 micrograms 3 times a week is where you kind of start with the retatrutide. You can drop that down to about 100 micrograms on a 3 times a week start for more of an inflammatory dose protocol, right? And sorry, I have my wife actually on a interesting, nothing to do with the brain here, but more on an endometriosis protocol right now, and it has to include with retatrutide. I think it does a great job. It works great with her, but we have her on 100 micrograms 3 times a week. I don't need her to lose weight. That's the last thing I want for her to do. She's pretty tiny as it is. So, but 100 micrograms a week combined with BPC, TB, and KPV does a really good job with the protocol that we started on her. So not everything out there, it has to be for the specificity that we hear. It could be done at different dosing for different regimens.
Yeah, that was the one thing that I really appreciated about learning about peptides. And when I first came into peptide world, it was like mind-boggling because it's like these peptides can do so many things, and I wanted to fit them into like, here's my diagnosis, this is the peptide that you use. And I've had to rethink everything that I've learned. So it's kind of like, now I'm like, well, what is the mechanism of the peptide and how does it work? And would that apply in this situation? So it's a completely different way that that you do medicine at this point. And so I love all of these suggestions that you have and the way that you're using these peptides.
Yeah, it's fun. I mean, you actually, when you start delving into it, like you said, the science of it, you can actually start having some fun with it. Like, I mean, I don't want to like nerd out and say this is like the greatest thing ever, but it kind of is. If you start understanding the science behind it, it just, the plug and play mentality is pretty cool, for sure.
Yeah, I love that.
Another really good one for the brain kind of is on the same parallel pathway as SS31 is Matsi. Matsi, I kind of look at it truly as a longevity. SS31 is more of the organ protective. The Matsi is more on the energy mimetic, but they work really cool hand in hand. This is something as well. I'm either on SS31 or Matsi year round, one or the other. I just go back and forth. The reason I love Matsi so much is you actually feel that immediate burst. You feel that in your system pretty quickly. And the couple other cool things people don't realize about Matsi, it works on the AMK pathways. Long story short, it's very organic, organ protective, and it actually is very cancer hating. It's almost going on the opposite pathway of a lot of these malignancies. So you're not looking to fuel a bad pathway within your system. This is going to work for the cells that are actually needing the help in a very organized pathway. It's really cool the way Matsi works. Also, from the way Matsi works, higher doses tend to reverse a lot of receptor stagnation. So one of the crises we face now in the United States is people have been on GLPs for 1 year, 2 years, and they're on these whopping major doses. We've been able to actually get people back on these normal sized doses by adding in some decent sized Matsi protocols, right? So if you put them on a high dose for a couple of weeks, the receptors just basically melt away back to normalcy. And then you can start them on a lower dose protocol, which they actually will benefit from and have less risk when it comes to it.
Oh, so I love that.
So Matsi is really cool with some of the things you can do with it. So another really good one for the brain, but just overall from longevity and wellness perspective, it's a great peptide.
Yeah, I like Matsi, basically for everybody. I'm like, oh, you have mitochondrial dysfunction. You have mitochondrial dysfunction. Everybody I see has got like mitochondrial dysfunction. I'm like, Matsi for everybody. So.
And then with the brain health, it kind of goes back to like the whole thing when it comes to hormonal optimization. It's your growth hormone aspect of things. Once again, I always say testosterone tends to parallel growth hormone. So if you're getting to the point where you gotta substitute and get testosterone to your system, you're probably gonna need some growth hormone one way or the other. Buying pure growth hormone is extremely expensive, cost prohibitive. It's pro-inflammatory. So going down the pathway of getting tesamorelin, ipamorelin, any of these other precursors. I don't like sermorelin personally myself. CJC 1295 is another one in the category. You're going to help with the better output endogenously of tricking your brain into creating more growth hormone within your system. And that's what you're also going to need from a mental happiness and peace to a certain extent. There's a reason why taking, ipamorelin and tesamorelin at night actually helps precipitate better sleep. I mean, this is a really good setup for better sleep if you do take it at night. The CJC 1295, some people feel that pulsating aspect of it as you get the growth hormone secretagogue pushed into your system. So it can actually be a little problematic for some people trying to get some sleep on it. So maybe taking that first thing in the morning, empty stomach, may be better for some people. I often categorize IGF, LR3 in the same growth hormone factor category, I guess. They're not the same, but IGF is more downstream. The growth hormones are more upstream. But your end goal is when you start getting growth hormone, you're going to have an extra output of IGF. And after about the ages, I would say maybe depending on how your lifestyle is, from 50 to 60, you're going to get that point where the tesamorelins, ipamorelins, they're not working for you because you don't have the endogenous ability to make more growth hormone. You got to then make that switch over saying that, hey, I don't think it's going to happen. Let's just go IGF. And IGF will get you that end result, which is your insulin-like growth factor. And from that aspect, you do get a better overall support system for the brain to process. And it is an insulin-like growth factor, right? So it has a lot of insulin-like properties. You will have better insulin, improves upon your insulin resistance. Be careful. You may have a little bit of issues when it comes to your glucose dropping at times. You may end up having those. You got to be careful when you do take it and don't eat. But yeah, it's got a great ability to really potentiate brain health. Do
you follow levels of IGF?
So you can. My whole premise is this. You can go down this pathway of testing, and I love testing to a certain degree. I prefer genetic testing to know what is needed to be put into the system. And then getting some baseline markers. But after that, to me, if you get, if you start following these growth hormone, growth factor on a regular 3-month basis, let's just say that's when you get your blood work, it becomes costly, right? So I'd rather follow the pathway of, you're having some subjective improvement and your other basic lab work, your biological age, those things are starting to improve. Hence, I'm doing something right on the back end, which making those front numbers look a little bit better.
Okay, so Erin writes, she's looking for thoughts on peptides for autoimmune and neurodegenerative issues caused by MS. but still safe while taking, oh God, this medication, acrelizumab, that depletes B cells.
Yeah, all the ABs are tough. All these immunomodulators as a whole, they definitely wreak havoc. And I can get to my little story as well in a second. So there's a few things good out there, right? If you're looking at any of these autoimmune, problems that you have, the first thing we have to look into is the genetic aspect behind it, right? Is this a genetic mutation that caused this? Is this idiopathic? Because that actually makes a difference in not just how you treat, but how aggressively you treat and the chronicity of your treatment. What do I mean by this, right? So if you have a genetic mutation, you are always going to revert back to that genetic mutation because you now are genetically having that mutation. Unless you go down this pathway of having CRISPR and having a gene editing, you're not going to overcome this. What you can do, and I like to call this the genetic overdrive switch, you want to put in aggressive protocols in place to have that aspect, whether it's 5 or 10% that's working, to overdrive what's not working, right? So, for example, and Aaron, sorry about that. I guess you were just diagnosed 3 weeks ago. That's tough. I empathize with you tremendously on that. But definitely find out if there's a root cause, idiopathic versus genetic. So I'll use my story and I'll make it relatable to you, Aaron. I have ulcerative colitis. It is a genetic mutation. That's the cause of it. And what I ended up doing is I loaded myself up with the cell factor. And I've been taking the cell factor now on a month-over-month basis. That does great. The other aspect is you got to bring down the inflammatory aspects within your system. So you need to have a protocol. And the protocols are going to be based off of several different peptides. BPC 157 and TB 500 do a great job when it comes to decreasing your overall inflammatory cascade with your system. KPV is phenomenal as well. Thymosin alpha-1. I want to talk about that real quick. Thymosin alpha-1, you guys know, is a great immunomodulating peptide. It is insanely potent and powerful. I found that out myself because the thing is, when you're taking thymosin alpha-1, you feel great when you have one of these disease processes. You don't feel so great when you end up stopping it. So you got to be careful about it. It's not something you want to stop cold turkey. It's something you need to taper off. When you do come off a cycle, you can't just go cold turkey. So I did that mistake myself, and we don't all make the right decisions all the time. I did that mistake just last week, and I was dog sick for about 4 days. So, but yeah, that would be my answer in a long, drawn-out fashion there, Aaron. And I'm sorry that you have to go through what you're going through.
Yeah, that stinks. I was just talking to a woman yesterday who does like home infusion for IVIG, and first thing I was like, well, what are all the different conditions that use IVIG? And then 2, are there peptides that could supplement and or replace IVIG treatments, which are not they're not easy to do. They're not easy to get through.
No.
And there, there's lots of possibilities, and some of the stuff that you're talking about was absolutely would benefit those patients.
And then also on that, Aaron, microdosing of retatrutide will be great. SS31/Matsi, going on one of those back and forth. They're both very good on inflammatory conditions. So also going back and forth between the two. So, thymosin alpha-1, I don't think is it's tough if you don't know how to wean yourself off properly. So even if you avoid that altogether, but you do a BPC TB with Matsi, and then you switch over to a SS31 and a KPV the following month, going back and forth, you're not going to have any ill effects of any needing to wean off. And then you can keep yourself on a Reta/CAG every 12 weeks, switch on and off of that. That's probably a pretty good protocol for you. And yeah, Aaron, I agree. Yeah, it is hard with the B cell component for sure.
Cool. All right. So, do you have more neuropeptides for us? What about? So you guys had Dhexa for a little bit.
Yeah, so we still have Dhexa.
Okay.
We're going to bring it back. The manufacturer that we were using, we fell out of favor with. So we're going to we have a few other manufacturers. And plus, just letting you guys know, starting in about 23 days. So starting June 1st, hopefully, that's kind of our go live date. All of our products are going to be manufactured in the United States through the same company that we're using the cell factor with. They're going to be manufacturing our peptides. So we'll be getting a lot of the, everything's going to be US based manufacturing.
Oh, that's awesome.
Yeah. But yeah, the Dhexa, I'll actually mention Dhexa, 3 other things actually. So Dhexa is a phenomenal peptide. It actually helps with neuroplasticity. So it remodels the brain, truly remodels the brain, which is really cool. Truly speaking, to get the best outcome for Dhexa, you want it in an oral capsule. We don't have the oral capsules just yet. The sub-Q does work. It's just that you end up losing a lot on it. So which is crazy because you usually think oral is where you lose things. In this sense, you need the oil to break it down in a certain way. People do IV Dhexa as well. What we have is not suitable for IV at all. It's going to mess up your veins, so don't do that. So that's where we are with Dhexa. We will be offering as well in June a couple other really good brain peptides. One is going to be 5-amino 1NQ. We'll have that on our formulary. The other one is tesofenacine, which is great. Tesofenacine works on neuromodulations tremendously, but it also helps with appetite regulation, metabolism, etc. So it's a combination of everything. So truly a longevity peptide. So we'll have that. We'll also have BPC 157 in oral formulation, and then the other one will be SLUP 332. We'll have an oral formulation.
But what is that? I've heard people talk about that.
So it's interesting. It's a kind of a peptide. It's almost kind of a SARM too. It actually hits on the estrogen receptors. So it works almost as a SARM for the estrogen receptors. So you get we're talking about estrogen being good. So it actually improves upon your energy and your exercise capabilities. You end up burning more fat. It helps with mood tremendously as well. And it's one of those that pairs really well with like your mitochondrial enhancers.
Okay. All right. So I love it. You have PO stuff coming in June.
Correct. We'll have that up and running in June.
Love it.
And then, yeah, we will be going mostly, like I said, on most of the injectables will be coming from Oklahoma City. The GLPs will be coming from Oklahoma City for sure.
Okay. Yeah, that's great. So what about the Cerebral lysin? Is that something?
Yes. Last but not least, our Cerebral lysin, our best friend, which I have a hard time finding a good source for. But I mean, this is truly the studies they've done in Europe, and you can actually Google this because it's actually out there. They medically treat people in many countries with Cerebral lysin. It's a very common thing to do. Unfortunately, in this country you can't, which blows my mind away. But you see you'll see these like crazy images, like perfusion studies post-stroke, right? They'll give people alteplase and these other things in this country, which does improvement of perfusion, but they'll also give people Cerebral lysin and some of these other countries, and you see how much reperfusion that they have, how much ability they have to recover status post some horrific stroke, some horrific TBI. And so there's a lot that Cerebral lysin can do because it works very well as a neuroplastic agent. Really remodels the brain, really works on the vasculature, and really does a good job. I don't know why. I mean, it sucks that we don't have it in a medical format here in this country. But Cerebral lysin is probably one of your best neuro drugs out there for most neuro disease processes. So,
okay.
But we're still working on a good procurement of sources. Most of the good sources tend to come from some of the European countries, Eastern European countries. So we're still looking to get a good source.
Okay. Yeah, I'm looking out for that one. I'm waiting for you guys to stock it.
Absolutely.
Awesome. Well, this has been amazing. Do you have other slides or other?
I mean, there's other programs I was going to talk about. The neuro is pretty straightforward. I mean, there's other things you can do with some of these other programs. Like, we have these typical weight loss programs here. I can send these out to you. It's really about what you're looking to do. I mean, I like, epithalin being a really good longevity peptide. And really one of the other ones I'm going to start pushing forward on now that we have a good source, a repeatable source, is FOXO4 DRI. FOXO4 and DRI and epitalin, I think, work really good hand in hand together. So there's a protocol that we're putting together. FOXO4 works on the P55 receptors, P53 receptors, sorry, where it creates apoptosis in cells that are sensitive. They need to go. So let's just create that apoptosis, make these cells go away. Otherwise, the cells are going to hang around. They're going to do bad things, and we don't need to deal with it. That's how FOXO4 works. So this is one of those you take once or twice a year, every 6 months, let's just say. You could do a cycle of whether it's 14 to 20 days. It's really upon how aggressive you want to get with this, but it's a 2 milligrams every other day for those 14 to 20 days. So whether you take 7 injections or 10 injections, that's kind of up to your discretion, I guess. You do that. That's kind of your cleansing of your system. You kill off a lot of these cells. You do feel kind of rough during that time period, especially the first couple of injections you do, because you are actively creating an immune response in your system by knocking off cells that are probably needing to be knocked off. There's really good studies with FOXO4 where your hormonal balances, a lot of the aspects with inflammation that creates hormonal deficiencies within your body starts to go away right away because you're killing off these sensitive cells, which are just blocking off your ability for your body to actually regain its normal homeostasis. So the protocol really on this would be you hit them with the FOXO4 DRI, let the body kind of get back and relax, give it a week. Now you hit them hard with the cell factor. We want to go cell factor hard. Now you want to regenerate and recuperate from what you've already pushed out of the system. So you put them on a 3-month course where you do today we do the FOXO4, bridge them onto the cell factor. And the tail end of this is going to be the epitalin. And the epitalin is going to be emphasis on creating better cellular life through the telomerase pathways. And you pair this at the end because you've now taken away the cells that are problematic and you're focusing now more on the regenerative process. So that's a pretty cool pathway. I think it'll help obviously from a brain and longevity pathway, but from a holistic pathway, it does a great job as well.
Yeah, that's amazing. It's, I love that you put these into like 6-month protocols too, because like it really gives people that sense that this isn't just something that you do this week because it's interesting or exciting. It's like it's a lifestyle change, and you want to incorporate them into your life. And you're not going to take the same peptides, from now until the end of your life. It's like you're going to cycle them. You're going to work on these different pathways, and you're going to create like an overall well-being.
Absolutely, absolutely. And this is kind of the protocol here that you can see. That's kind of the goal here. But yeah, I'm open for any other Q&A stuff. Katie, please, any questions you have, anyone else has. But I wanted to kind of talk about those neuropeptides more than anything else. But right. I'm open for any Q&A.
Yeah, absolutely, guys. If you have questions, now is the time to ask them. So put them in the chat. Whether you're watching on Facebook or YouTube, it'll come through and we'll be able to see it. But, I had a stroke patient, post-stroke patient, but he was 2 years out. His right side is really weak. So, I don't, I would have loved to have given that guy cerebral lysin, closer to the point at which the stroke happened. But I don't know how much rebuilding the peptides can do, or if they're going to create different pathways to circumvent areas that were destroyed by the stroke. Do you have any thoughts on that? Or
without the ability of cerebral lysin, your best bet's gonna be cell factor still. You're not that far out timeline wise, and this will be something you'll have to give in a couple different formats. You can do definitely as intravenous, but you can also do it as a intrathecal literally to the base of the skull to get it into the brain. But cell factor would do a really good job of regenerating those cells that have been initially lost, right? So if there's even a small percentage left that's working, this will recuperate and get them back to the functionality that they once were.
Okay. And you prep people mentally for a 6-month program of every month getting cell factor.
Yeah, that you have to, because it's the worst thing you can do is tell them it's a one and a done deal, because that's not going to get them anything that they want, and then they feel like they've lost their money on this protocol, right? But yes, you're going to have to do this for about at least 6 months aggressively. And then after that, it's going to be reevaluation, see where we stand. Some people are going to need more. Some people may not. We've had success stories with quadriplegics that have been able to pretty much start ambulating to a point again, which is remarkable through the cell factor. But it was hard work. There's PT involved. There's, it wasn't just a sole fix, right? You had to do a bunch of other things to get to that point.
Right. Yeah. I like to tell people that too, because like you had mentioned before, it's trash in, trash out type of thing. And it's, I have had people come and they're like, I just want to get like an infusion of stem cells. And it's like, okay, but you're fat and you're a disaster, and that's fine. We can certainly do stem cells. It might be a starting point, but it's not the ending point. Like there's a whole lot of stuff that needs to go into this. And it's definitely a lifestyle change that we need to look at.
100%. Aaron, we're gonna get this a little bit more marketing look to it, and then it's gonna be placed on a website here. We have some resources right now, but a little bit more is gonna end up being placed there. I'm gonna put this into the chat. 1 second here. Oh, I gotta connect to the YouTube account first, I guess. Okay.
Oh, if you want to send it to me in private chat, I can put it.
Okay. Okay, I'll have to do that. I'll just text you, Katie.
Okay. Now, I know you guys have Peptide University. Do you want to talk about what that is?
Yes. So Peptide University is going to be your best friend for a lot of things. So obviously this is a partnership that we have with Melissa Peterson. She's awesome. And what we were able to do with her is set up these more, I guess, CME style, continuing medical education style courses. I mean, she's created this out from scratch. She's done a phenomenal job. So the whole premise, the way I look at what Peptide University is, I call it the med school for peptides. So you're going to learn literally the science behind everything. And when I say the science behind everything, you're going to learn how, BPC 157 works in the body. You're going to learn about TB 500. You're going to take 3 or 4 different courses on it, and then you'll end up taking a finality exam to make sure that you have the understanding of it. And then all of a sudden, boom, you're signed off. You'll get a certificate of completion. That is now in your bag. You're done with BPC 157. So every one of these small molecules we discussed, it's on there, and you'll be able to get through this, get your knowledge base filled up. And then there's going to be some webinars, myself. There's a few other people that come on and give some talks on a regular basis. And then lastly, we are going to be adding a few more things on here where there's going to be information about developing the business end of things, how you could really add in the ROI to utilizing these programs. So that's still some of the aspects we're building out right now. Right now, it's definitely more focused on purely the education, but we'll be adding those things.
Yeah, and Melissa's, I've taken a course with her before, and yeah, it's amazing. She breaks it down so that you understand it and that you can find things easily. So I would highly recommend that.
And then I'll send this to you as Katie as well. We're going to have a couple live events that we're going to be streaming soon as well for those that are interested. We have an event next week in Dallas. If anyone wants to join, I've sent you that information just now, Katie. And then there's going to be another one in Los Angeles the week after, a live event in West Hollywood, sorry. I don't have that information just yet, but I'll get it to you when we have it.
Okay. What's the link for this Beyond Healing? That looks neat.
I don't have the link yet. We'll get that to you.
I'm sorry.
Yeah.
You just said that. No. I was reading. All right. And so that one, but that's in Texas. So is that going to be live streamed?
Yes, it is.
All right, perfect. All right, love it. Yeah, I really want to do that one. All right, cool. Anything else that you want to share, or any last questions that anybody has that you want to get in here?
I got nothing else here, unless anyone else has anything.
All right, Dr. Arvin, this was amazing. Thank you so much for your time, and thanks everybody for joining. That's sivaadventures.co/resources. The link is in Facebook and YouTube, so you should be able to find that now.
I appreciate it, Katie, so much. Thank you.
All right, thanks so much. Bye, guys.
See you. Bye-bye.